Dr. Jennifer Ashton, thank you so much for joining us today. Last week, the FDA rescinded its authorization of the final monoclonal antibody treatments in the U.S. Does this mean that we've turned a corner in the COVID pandemic, or are the treatments just not effective anymore?
I think it might be a little of both. I think it's really important when you hear a headline like this to think of a couple of important elements. Number one, the FDA is always in real time reassessing and evaluating data and analyzing that data, not just for safety, but for efficacy. In terms of turning a corner, I think there's no question we're at a different point in the pandemic. Why? Because we're seeing new subvariants. And what we're seeing is when we become introduced to a new subvariant, we have to ask, do our diagnostic methods work? So are our tests picking that up? Are our vaccines working? Are our therapeutic tools like monoclonal antibodies or other antivirals effective? So it's not just an issue if they're safe, it's an issue of are they effective? And the FDA, on analyzing the data, particularly with respect to the primary circulating subvariants right now, found that those monoclonal antibodies, for the vast majority of people, there are always exceptions clinically, are just not effective, and that's why they rescinded the authorization.
And it's been 2 weeks now since Thanksgiving, and have we really seen an increase in COVID cases?
We certainly have, definitely in some parts of the country, just as we have with influenza. None of that should come as a surprise to anyone because we know that as people shift and they move around and they congregate and they're in cold weather areas of the country, so they're indoors with poor ventilation, that these respiratory pathogens like to do their thing, and that is spread and transmit disease and infect people. So that's what we're seeing. And I think as we go into December and really the depths of the winter, we do expect to see those cases go up as well. Again, sporadically, because this is not a uniform thing when you look at the entire country.
And how are we gauging it? Is wastewater still being tested? And how are they monitoring it with so many people testing at home?
That's a great question. So wastewater testing obviously is an important tool. Not every city is doing it clearly, and we heard that the FDA recently authorized a central at-home test system where people who do a COVID-19 test at home can anonymously and confidentially report their positivity so that we can track these. Obviously, it's on the honor system, but when you look at flu cases, those are estimates. Those are what we call ILI, influenza-like illness. So we have to put all of that data together and then try to aggregate and analyze it. And we're behind in the way that we do that in this country for all infectious diseases, not just these respiratory ones.
But best advice for people as we head into the holidays, what do they need to do to keep themselves safe?
Vaccinate for both COVID and influenza if you haven't, or if you're not up to date. Keep your hands clean. Try to be in open ventilation as much as possible. If you are sick, stay home and don't expose others. And if you think you have an upper respiratory infection like influenza or COVID, do a test, because the results of that test absolutely can have implications on your management and possibly treatment as well.
Okay, Dr. Jennifer Ashton, thank you so much.
Good to be with you.